Estamos en el Center for the Critical Study of the Health of Latinx Communities here in California.
Qué bien que el proyecto que están manejando lo apoyo 100%, es el trabajo que se ha hecho para hacer salud. Como parte de, yo participé en un movimiento Chicano Movement, el movimiento de chicanos, chicanas, y queremos que sepan que ese movimiento sigue hasta este día. Nunca se ha muerto, pero al tiempo que yo voy a tratar de decirles, era algo que empezó de nada a algo que empezó y sigue de mucha fuerza.
Vamos a ver si aportamos nuestro granito de arena. Por ahora voy a pasar la palabra a nuestra estudiante estrella, Nancy García, que también va a participar, igual que el doctor Charles Briggs, en las preguntas que vamos a hacer.
Sí, it's an honor, es un honor para trabajar en el Critical Study of Latinx Communities. Y vamos a empezar con nuestro primer. It's an honor to speak with you today here at the Latinx Research Center. Please tell us about yourself and the trajectory of the time from your academics to how you were able to fund Latinx de la Raza.
Well, to create and to fund Latinx de la Raza, there were many things that preceded that, and I was very and have been very proud to have been part of that. And the unfortunate reality that I've been addressing most of my life was the lack of activity, the discrimination, the inequality, the doors that were constantly closed or not even identified for our people. And so the movement that motivated me was that those doors be knocked down wherever they were. It happened to be in the legal area, so I came here to the law school after graduating from UC, University of California, Santa Barbara. I came here not knowing exactly what I would be doing, but there were people who had thought ahead for me. So they began a legal center in the Fruitvale of Oakland, and it wasn't a matter of choices. You're going to go work there. So I said, okay, this is exactly what I wanted to do, was to have the movement I've been a part of already, which I can discuss more when you would like me to, if you would, have that become real in the Fruitvale district of Oakland, not just a building with a name on it, but something that is really done together with that community. And so I've always wanted to be part of the communities that made the change, that opened the doors, that kept things going and growing. So.
That's wonderful. Well, precisely along those lines, can you tell us a little bit about the inequities that you experienced when you were growing up and how it was that you ended up joining the movement in order to be able to confront them?
Well, in growing up, as we all have, we've had different health experiences. I was born in Durango, so I should have my shirts hecho en Durango. I wore that. I wore that recently, and we went far away, and it wouldn't be expected that in Prague you'd have somebody wearing hecho en Durango, pero con mucho orgullo. Soy mexicano, nacido mexicano, pero llegamos de Durango con mis padres a Tijuana. Y como niño en Tijuana empecé a tener experiencias donde necesitaba atención médica una vez porque me quemaron con brea en el brazo y eso se tuvo que tratar. No había doctores. Básicamente en la farmacia se buscaba lo que podía hacer para que la persona ya se aliviara. Se alivió con la cicatriz que tengo. Y esa cicatriz nunca me ha dejado, porque yo, aunque pasan cosas a gente, accidentes, tienen que tratarlo en el modo más alto que se pueda, con una calidad. Así es que estuve un año en Tijuana, también tuve otras experiencias, pero todo se trataba en farmacia. Entonces nos mudamos a los Estados Unidos y siempre mexicano. Mi mamá siempre decía, no te olvides que eres mexicano, y nunca me olvidé. Pero estando aquí en los Estados Unidos era diferente, pero lo que era igual es que no se podía llevar al doctor cuando necesitaba un tratamiento, lo que sea. Desgraciadamente mi madre tuvo unas experiencias que tenía, en vez de tratarle para su parto como debían, no la trataron bien, así es que perdí 2 hermanos así, y me puse a pensar por qué, eso no debe existir. Y me decía mi mamá, pues ni me ponen las manos, como me tienen miedo. Entro al cuarto y me ven y me dicen algo y ya estuviera que te vayas y nada más pasa. Así es que empecé sin saberlo, tener esta idea que esa desigualdad nos estaba perjudicando mucho, que no nos dejaba tener la calidad de la vida que debemos de tener. En después de Santa Bárbara estuve en el Valle de California, y también allí lo mismo, muchas cosas que una persona podía ir al doctor, debía ir al doctor. Por ejemplo, me quebré el brazo 3 veces y pues fui como un sobador, pero estaba quebrado el brazo. No, el sobador pudo poner era aquí el hueso para donde debía estar, pero no se arregló. Por fin recibí tratamiento, y eso fue porque el doctor que me aceptó gratuitamente hizo la cirugía, muy experto, pero quería poner mi brazo en ejemplo en un libro. Era material para él escribir en algo, en libro. Me puso así fierros para mantener mi brazo y me alivié. Y le debo a él todavía mi brazo, ¿verdad? Pero el modo en que recibí la atención que necesitaba no era como uno debería de esperar. Así es que eso tenía en mente. En los años en la universidad en California, Santa Bárbara, no tuve muchas experiencias malas, pero cuando llegué a Berkeley, después de Santa Bárbara, llegué con esa idea que hay algo que se tiene que hacer en la comunidad para que no siga esta desigualdad y que no perjudique a nosotros como está perjudicando. Y Fruitville, Oakland, así era. No existían doctores. Los doctores que estaban allí antes se habían mudado con las personas que tenían los recursos para pagarle. Como no tenían recursos los mexicanos en general, no había nada. Había nomás un hospital general. Y ahí empecé. Allí se empezó la clínica. Pero para mí, ahí llegué, como llegué.
Gracias.
Well, our third question had to see with the problem you saw, but you saw to go in that path of founding a clinic, but you have telling us in the beautiful way all of those experiences. And how did you confront then those inequalities that you see? How do you just having this in the memory inside you, embodying you all of these inequalities? Where were your beginning? What did you do?
Well, I came in order for me to get into the community to do a particular work, I needed people with me. And what I was fortunate to find when I came to Berkeley, though we had started Santa Barbara, similarly there were finally enough people to form an organization that we called UMAS, and that later became MECHA. And so I was involved with that, and I had a lot of ideas about how to exercise my political rights. This was also during the time of the Vietnam War, so we knew that throughout the world there were things that were happening that shouldn't be happening. So I came to Berkeley with the idea that being a student also is not just a matter of status, and that we are privileged as students but we have an obligation that comes with that, and it's an obligation that has to be done at the same time. It can't be put off until I get around to it. It's not noblesse oblige. It's not that. Yes, except some people, and we could talk about philanthropy and charitable this and efforts that are laudable, but really as an individual, you can't wait. I felt I can't wait. So I got involved with legal services because there were students after the Third World Strike here at Berkeley that had organized at the law school. There were about 7 or 8 Chicano law students. There were no Chicanas at all. There were no women, no Chicanas. They organized Centro Legal de la Raza, which is where I was picked up and taken to Fruitville and said, "This is where you're working." I said, "Okay," and here I am. And we all worked there doing legal work. It just happened that I took on, there were many issues to take on. There was homelessness, there was landlord-tenant, there was people who needed counseling for the draft. There are a myriad of issues, communications. And law students, even then, there were 19 to, actually there were 21. It was the first Chicana law student ever that would acknowledge that was admitted and became a law student at what is now called the University of California, Berkeley at Bolt Hall. And so, I mean, in terms of firsts, that gives you an idea how far back we were even in 1969. So we all did our projects, and the project I took on, I took other things on. I did individual counseling, went to a lot of fair hearings. I think I did more lawyering as a law student than I did as a lawyer later. And I took on the health project. So that's how I got involved with health. And to your question, the usual thing you have to do a needs assessment, right? So we announced the committee and we asked people on the committee what they thought. And there's no surprises in that. They thought, we don't have anything. We don't know where to go. There's no access for us. If we are sick, we're lucky to, we have to go to home remedies, or we just suffer. We don't get the attention. So we decided we'd do something about it. And that's where La Clínica de la Raza was born.
8.
Amazing. You've been involved in many organizations and social movements. So with Mecha, the Clínica Legal, and the Chicano movement. Can you tell us more about how those experiences shaped you and how you felt and why you wanted to keep being involved?
Well, the experiences, there are other experiences also being involved with farm workers and being influenced a lot by Cesar Chavez, the leaders that we had at that time. Actually, there was a lesson, I think, I don't want to get a lot into it, but at that time, our leaders were systematically assassinated. Malcolm X was assassinated, Martin Luther King was assassinated, Robert F. Kennedy was assassinated, and he had just grasped United Farm Workers. I mean, he was running, he has his own ambitions, and people have mixed feelings about why or what he was doing. But those things there were repercussions. The war at that time brought a lot of people together, the war in Vietnam. So in bringing that together for me, and there are other things that I could refer to, but in particular was why should I be going to another country and killing people that I have nothing against or have done nothing to me when I could be here serving my community? So we have a number of people that got together. There were conscientious objectors. That was the early core that people are not aware of with La Clínica de la Raza. Both physicians and other people who were not physicians, they're involved with accounting, or they're called different things that are involved with doing health. Because if you think about it, being involved or getting a community group involved with doing healthcare in this society, healthcare, being in medicine and dentistry and all this, it's one of the most legally complex areas you can get into. And so it turned out to be not an advantage and not a disadvantage, because everybody would look at us and say, well, you're crazy. You know, how can you take on something that big and think you could succeed? And our response always was the same. Let us try. You don't think we can? Just give us whatever, even if limited means, which it was always very limited. And we got the limited means, and we got more people together, and we did more and more until, and we were doing it with the community, and they were saying that they were finally getting something that they needed for them. They want more. So the demand of the community was more services. And with the law, also with legal services, we need more legal representation. But in healthcare, I think that's the most basic. As has been said, of all the human rights, I think healthcare is the most basic, the most important. So we just kept up our belligerent. We weren't against people. The ones that didn't want to help us, just told them to get out of our way. And those of you who want to help us, come and work for us, or give us some resource, and we'll take them and we'll do what we can with them. And that's how it started.
That's fascinating. Can you tell us a story? You've got all the players there, all of the issues that are there. What was the spark? What was the very beginning of La Clinica? Was there a moment, a conversation? How did it suddenly emerge?
I'm not sure it was the spark, but it was one of the sparks. This was a time also where there was the economic opportunity programs. There's supposed to be a war on poverty. There's supposed to be other things that are going to make things better in our community. I think even the Ford Foundation had a community development kind of aspect, but it didn't include health. And the war on poverty and the programs in Oakland in particular, health is not on their mind. They kept, for example, the people that were in charge of the economic opportunity program in Oakland, they promised, we'll find a space for you to occupy. So they offered the space 2 or 3 times. And then it came down to it, and oh, sorry, something else came up. So we said, forget it. We'll just find our own space, find our own storefront, and just open the door. You know, and at that time, I think the critical thing is that there were enough people in the medical schools, the pharmacy school, dental schools, public health schools, and in general, undergraduates also that were involved. They just started coming. People just came together. And you didn't have to convince them of anything. This was a matter of, what do I do? And we didn't know what to do. We said, we've never done this before. ¿Quién sabe qué se hace? Pero había gente que sabían qué hacer. And they came forth, enough of them came forth to guide us through some of the very tricky steps. And there were a lot of steps to go in. We didn't have licenses, so we had to go to the legislature to get licensed. And we didn't have people that knew how to renovate buildings or buy buildings or build buildings, so we had to go find those people. So we wound up having a very diverse group of people coming together to actually govern what we did. They didn't just say, we want, give us, said, we want it this way, and we want to tell you we want you to do it this way. So even from the first time that La Clinica got together as a corporation, it gave the voice and the determination, the power to determine what isn't done to the community itself. And we had people that were in the faith-based community. We had a very strong board member. There was the pastor of the local Catholic church. There were some other more evangelical people there from the faith community. There were people that were just actors. They were involved with every issue that came up, and they were there and helping us every step of the way. And people in the community, even people that had really well-paying jobs, they just left their job. They took less salary, but they knew that it was going to reach who they wanted to reach. So that gives you, I think, an idea of how it came about, and forces that a lot of it wasn't planned. It was just happened spontaneously. El movimiento.
Are there any names that come to mind, and what year is all of this taking
Well, The years were that I got involved, and we started with 1971 was when we opened the door, but we've been busy from 1969, 70. And actually there were people that had been organizing in the Fruitville community, CSI, for example, the Community Services, CSO, I'm sorry, CSO, Cesar Chavez was a part of CSO in Oakland. And there were other organizations that they weren't like, at that point, saying they were radical and wanted to turn things over. Like, we were crazy. We turn things upside down. We weren't going to take no for an answer from anybody. I'm not saying they took no before for an answer, but there was always pressure. There were people in education that formed their own schools. Centro Educativo, for example, was formed at that time, and there was a group that formed La Escuelita. These things did not exist, but they insisted on those. And all the people that were involved that kind of knew each other. So they helped each other out. And there is a book that has been written on that experience, and it's very enlightening. I brought it if you'd like to see it. The author's name is Juan Herrera. He's at UCLA. He's a PhD professor at UCLA, and it will kind of would give an idea of how people just coalesced to make the changes.
Wow, and I wanted to know about other leaders, but I also wanted to add to this question is, you said earlier in the interview that the people who were working for the freedom, for communities were killed, and you put Mark on X, Martin Luther King. And that came to my mind that they were symbolic, if no really direct part of the Black Panther movement. And I wanted to know how was the influence of the Black Panther movement in you were talking earlier in the interview about the assassination of the leaders that caused a big impression to begin your movement. Mm-hmm. But I wanted to know exactly what was the influence, if was in that case, of the Black Panther movement and their serving to the communities with doctors and food and everything. And the other thing that the other part of my question is, who were those leaders that began with you this movement or La Clínica?
Who is the
other leaders?
Dr. David Hayes Bautista was another leader, and I think, and there's a person by the name of Alec Velasquez. I have lost track of him, but they were trying to make sure there were resources from the campus that were going out to the university. But all this was in the context of civil rights. Mm-hmm. So what was happening at that time was there was a huge not only anti-war movement, there was also a huge civil rights movement. It had been going on for quite a while. Here at Berkeley, the free speech movement sort of contributed to that, and it gets a lot of attention, but also the Third World Liberation Front here at the Berkeley campus, that's really, in my mind, that was the most significant movement that there's ever been here at Berkeley. It hasn't gotten the attention. And then, unfortunately, also there were leadership disputes amongst our own leaderships. But the broad leadership of civil rights is what was guiding us and still guides us today, I think. And I would say civil rights and political rights, health is a human right, economic, social, and cultural rights. We believed in those things. A lot of the other people, even then, didn't really believe in it. They may have signed a few things that, like Voting Rights Act, that was extremely important. Okay, so, and I think there were people that believed in it, but as you can see even today, they don't believe in it anymore. I mean, not really. So there were mixed feelings. The relationship of organizations like ours that were doing what be considered service was not just service, it was to have liberation. It was to have liberation from the kinds of forces that were working against you, that were keeping you out of jobs, that were keeping you out of services, that were keeping you out. It was a liberation movement. So my motivation and the early motivations, and I still think to a large extent today, amongst community health centers anyway, I would say, they want to liberate people in a way from needs. The Black Panther Party was only partly a service organization, and actually in my view, and they did make some very strong statements and move things along in a way they couldn't have been, but they were media oriented. They knew how to get the attention for the media, make the points. They were strong points. They were well-made points. The service part was not as strong. Okay, the women in the Black Panther Party, they did the service. They really, and that was free lunch programs, other social services. So George Jackson Community Health Center was set up. Okay, unfortunately, I think they were. I have COINTEL Pro. I don't know if you ever heard of COINTEL Pro. I think in many ways they were sabotaged. There were people from within that created situations that put them at a disadvantage, not an advantage. Then there's the whole issue of whether or not people should do things violently or not. And with Cesar Chavez's influence, I think, in large part to the Chicano movement, nonviolence was really the way to go. What happened in Oakland is there was a group called what was it called? Liberation Front. I shouldn't forget what they're called. They were a very strong group that believed in violence, and it led to the assassination of the head of the schools in Oakland, Marcus Foster. Symbionese Liberation Army, as they called themselves. Okay, that made a very strong statement of what things actually are detrimental and not really serving liberation. It undercut liberation. It was an overstatement, an overdoing. We did have Chicano groups. At that time, there was a group like the Brown Berets. They wanted to have Black Berets, I think. Chicano Revolutionary Party. There were other groups in the community that had different points of view, but they never took hold of the services or more than being able to make a statement, and then that was it. They thought that was it. That was enough to do. The people I worked with and kept working with and have kept working with, we wanted to make a statement, but make that statement permanent, that this is not something that's a flash in the pan. It's done now, and it doesn't do enough for everybody, but it does. And then you do more later, and you keep adding it. And so I was not afraid personally of that. What we were doing for liberation was institutionalized. So if you take La Clínica de la Raza today, it's in 3 different counties. It has 27 different sites. It has, it's 53 years later, it's still there. So it wasn't a flash in the pan. It's still about liberation. But the rhetoric may have changed. There may have been, some changes about the way it's expressed. But it's changed the mainstream. So having something like the Obamacare, or having something like the clinics and health centers are the way now, through the correct insurance mechanisms, that people get access to care. And now all the way to undocumented children. Even when we were much earlier, undocumented pregnant women always got their care through La Clínica, and others. And the state legislature went along with us early along. Even if they didn't realize it, there was never an undocumented pregnant woman that wasn't given adequate care, even before Obamacare and all that. And then eventually the state changed its laws to about more. Now to the present, I think even adult males up to a certain age can receive Medi-Cal coverage. So that's a lot of movement. And it's all, I think, attributable to the efforts of showing what could be done by Chicanos, Chicanas, Latinos, Latinas that were in the movement. So there isn't a vacuum, which is what I've been trying to know. There was something that was very solid. It was different from other movements that were in civil rights, and I give them all their due. They really, and unfortunately, some paid the price. They look back kind of like they did this, but what is it today? I don't know. I do know about the Health Center. I do know about the Legal Center. 53 years later, Centro Legal de la Raza is like, it's like an 800-pound gorilla. I mean, you don't mess with them, and therefore the migrants' rights, for people that are for jornaleros, for people that need to be represented, for renters and so forth. So these originally liberation-oriented activities that brought people together in small groups became large and permanent. And that's what I think is really the most important.
Yeah, that's so amazing to hear. I'm a first-generation student. Both of my parents came from Mexico and Zacatecas, so I know the impacts of like undocumented and immigrants and just the Latina community needing access to those healthcares. But while these movements were occurring, you were a student here at UC Berkeley. You're going to legal. You're getting your degree in that way, and you're also pioneering these movements in La Clinica. So how are you able to reach populations in Fruitvale, like the undocumented populations, the Latina population? How are you able to reach them with other students and make sure that together you can actually make some change?
The balance is difficult, so I won't tell you that it isn't. But in many cases, people don't think that there's a balance, that they have to just be a this and it can't be a that. And the point I'm trying to make is that you can be a this and you have to do it to the highest quality you can. So you have to be a good student. You have to prove to your own peers and to your institution that you're in that you are worthy. But at the same time, you make the choices of what you study and how you go about it, and you still have time. It's just like people are going to sports many times. They'll be in sports and they'll still be students, right? Well, how can you still be in sports? Well, you can be in the community serving people and you're still a student. At some point, there is a point where there's too much, where you don't have balance with your personal life and your family life, and you have to really pay attention to that. So that balance is real difficult. All I can say is that from the work that I've done, the book that I co-authored, Chicano Boomers, Healing California, 1965 to 1985, all the people that I interviewed, which is about 200 people, they were able to keep that balance. So in each case, ask them how they did it. It's different. And you can do more sometimes, and sometimes the door really does get slammed in your face and you can't make it, but you've made the effort. And that's important. So I don't know if that helps you. I think as you get more involved with the community, you see, for me, as the law student, I wasn't a heavy-duty law student in a way, but what happened is after a year of my basic studies, I could see how I could use the tools, just like you use the wrench or you use you can use the tool that you were being taught to make people's lives better and to make the institutions change. And the part that I haven't emphasized at all, but I will emphasize it now, is that not only that, you influence people that make policy, and you influence them in the way that they make ethical policy, because anybody can make. You see the policies that are going down now. It's like Jim Crow coming back. It's like going back. Slavery didn't exist. Forget about that. And critical theory is not to be carried. That's not the case. You need enlightened, in my view, enlightened people, and we were able to convert, I think, many you already had there, the Board of Supervisors of Alameda County to being ethical policy makers, not only in healthcare, but involving the community-based organizations that, like ours, that work together with the public organizations to make big changes. And there have been big changes over the last 50 years here in Alameda County. And you can compare that to some counties where nothing has changed in 50 years. They're as far backwards, and I think that's the impact the Chicano movement had, the Chicana and Chicano movement had, and others coming together in civil rights. Policy is it. Policy, to me, that's one of the most important things.
Absolutely fascinating. So what were the most important health problems that were identified early on by Latinica? What were you addressing most centrally?
We were assessing a lot of time perinatal health. That was probably the most, it would come up the most. But the other issues that came up had a lot to do with child abuse and had a lot to do with mental health, lack of access to proper intervention when there was a problem. For example, one thing that was very common, and we ran into all the time, was that if there was child abuse at home and then they came in, you had to report, right? They would report, and it would go to Child Protective Services. Who would they call? The police. Okay? Who is the last person you want to be in charge of intervening in a sensitive mental health, probably labor-related injustice going on that's affecting a family? So setting up a mental health center became a very big issue for us, and we did. We set up mental health centers. Different age groups were affected in different ways of approaching, trying to get the police in particular to have different approaches to how they intervene with a family. A lot of times, let's say a father, take an example, a father might beat up a child because in reality they've been beaten, but getting beaten up so much in their work, then they come home, and they're already drunk and they're upset, so they take it out on their family. Well, some other things have to change so that doesn't happen. So it takes a lot of work. The kinds of problems that children had beyond that were a problem. People were bringing a well baby. We had volunteers that did, they're sponsored through the county. We had a well baby clinic, well child clinic. So you bring the child in. Well, the child's not well. It didn't take very long to find out. And then they said, well, we only do well child. So right away you have to have a full arrangement of pediatric services that you offer to be able to handle that. And we did. You got pediatricians. Some of the conscientious objectors came from Children's Hospital. They set up our pediatrics program to be a model program. Even to this day, it's a model program. There were a lot of issues of Planned Parenthood. We worked a lot with Planned Parenthood, but the whole issue of young pregnancies was, there needed to be more family planning. There needed to be more interventions where people could have their lives turned around before it was too late. And early pregnancies, we got a lot involved with intervening in social services and in other services that could help the family and the children in particular. That was a big thing that we did.
Those are incredibly important priorities. How did you reach those? Were you looking at epidemiological statistics, conversations in the community? How did you choose those target areas?
We can see there's what Dr. Hayes Bautista calls an epidemiological paradox. I don't know if you read about that. And on the surface, especially I think with migrants at that time, in terms of the diseases that were focused on the most, respiratory and other kind of chronic illnesses, the Latino health indicators were not as low as in other populations. And but that paradox, even though it was there, we had to make sure it did not, as time went along, it began to deteriorate. So fat foods, eating out of the what's it called, the quick dinner places, the McDonald's of the world and so forth. You wanted to prevent obesity. You wanted to prevent things that are going to come up as a result of that. A problem that I always had to face, both mental and physical health, is problems with overconsumption, with people, basically destroying their livers, too much drinking, that type of thing. So was that a health issue, or was that a mental health issue? We don't know. So we had to get them to get mental health and the health people together to try to find out what could you do best for this situation. So there was a lot of that that we found in the population. And as a matter of fact, when we started out, we started out at East 14th, which is now International in Fruitvale. And we were on the corner there, and that's where there's a lot of drug dealing, a lot of people that were inebriated. They would come into the clinic and they wanted a get sober pill.
That's very interesting.
I don't think we have one, but if you want to get better, you can follow this. This is the course of what we can do that you need to do and your family need to do. So we approach it that way.
So you look for structural problems and structural solutions.
Correctly.
Yeah, fascinating. I wanted to remind our viewers that we are interviewing, have a conversation with Dr. García, perdón.
José Joel García.
Joel García.
I know him as Joel. I always tell people that have a hard time with Joel, just the hotel without a T. Take the T out, and it'll be Joel García. And that's why I go by Joel. But total name is José Joel.
And this interview is for the Center for the Critical Study of Health of the Latinx Communities, under auspices of Latinx Research Center. And I now it's my turn to ask you a question, and you begin already. But there's an anecdotic moment that you remember along with the foundation of the clinic that can be to tell us about.
That's a hard one. I know. Anecdote was there's a woman who is now comadre, but she wasn't at that time, and she was pregnant, and as it turned out, she had a very, very difficult pregnancy, and so Latinica was able to intervene and get involved in such a way with both the child was born and was healthy, even though it had a very difficult delivery, and she was able to maintain her health, and she nearly died. Mm-hmm. So the whole idea to me, the whole big anecdote to me of Latinica is keep people alive and keep them well. And here I did it with one individual, and I feel really proud about that. And then another anecdote that sort of related to that was the attempt, this is more on the policy level, by the governor then of California. He's Wilson. He's a former, actually he was not a classmate, but he was a graduate of University of California, Berkeley. But he thought he could run to become president by by taking away all services from people, from undocumented people, from the Chicano and Chicana, Latino, Latina community at all. And so they tried to pass Proposition 187. But along with that, he also tried to take away the perinatal services program for Medi-Cal for women. Okay, he did that. He had the power to do that. He could just administratively eliminate them from the program. So we took him to court. Okay, and we fought him, all the way until he left. He was no longer the governor. But with that, we got an injunction that said that they couldn't cut the program. And then over time, even with a Democratic governor followed and didn't act quickly enough, we thought that, and we had a judgment, and we had to convince him, restore the program. So all that time, all those women that could have had all these adverse results, mothers and children, they didn't. And it was because we beat them in court. And so related to that, more recently, there was also an attempt to take away rights again. This is under Trump, to take away rights from undocumented people and people in general. And this time, La Clínica de la Raza versus Trump was the name of the case. And Trump lost. So the fact that you can fight them at all levels, at the street level, at the highest court level, at whatever level, is very important. And if it isn't attacked on all those levels, the bad things happen. I think that's the lesson for right now, that all these things that are being attempted have to be fought at every level, at the community level, at the court level. I'm not very optimistic about where the court is today, but that doesn't mean that you just give in. You fight them.
How about some anecdotic moment when you were assembling the Clínica de la Raza with your peers in those moments?
Those moments when I was
were assembled what is today the clinic, with your peer, with Bautista and other people.
I'm not sure I understand the question, so
Vamos a hacerlo en español.
En español.
Otra clase de anécdotas cuando estaban reuniéndose para fundar la clínica, cuando estaban pensando en fundar la clínica, ¿tienen alguna anécdota que resulte memorable en este momento?
No sé si es anécdota o no, pero lo hacemos con un placer, con un gusto, con amor de lo que estábamos haciendo, que mucha gente que estaba a contra de lo que estábamos haciendo o que nos ayudaba, pues nosotros nos poníamos a reír. Es lástima, pero no nos enojamos, pues así son, que sean como son, pero que no nos paren, que no nos quiten el valor de lo que estamos haciendo. Eso es yo creo, la acción principal. Pero siempre toda esa gente que se juntaba a festejar. En realidad es un modo de festejar. Es que también con mucho trabajo y no es fácil y el balance es difícil, pero se puede hacer. Y eso es lo que se debe decir por medio del Latino Research Center, Latinx Research Center, es que todo eso se puede hacer con amor, cariño y con gusto.
Y lógicamente con perseverancia.
Siempre. Que muchas barreras que les ponen a uno, las brincan y se reín cuando están brincando.
Okay.
As we've discussed, La Clínica de la Raza is one of the most amazing health organizations. Many health organizations have opened, but how do you think La Clínica was able to become a recognizable place for the Latina community?
Well, first you put up your sign. You'd be recognized, you do it with the art. If I had my book, if I can open it. Expressing your art, being, the murals on your building, your statements about how, you're well received there, then receiving them well, treating people well. That's how you convince them to keep coming back and to appreciate what you're doing. And when you make mistakes, that you own up to the mistakes as well, because complex services and complex activity, it's always hit and miss. It really is. I mean, you do things scientifically, you do things in the correct protocol that you're supposed to, and mostly it should work out, but sometimes it doesn't. So if you own up to it, and you account to your own board that's part of their consumers, they're people that use your service, they will tell you why and how you can correct it. If you ignore the community and just, well, I am who I am because I'm whatever, don't talk to me about it, you don't get anywhere. Yeah, it kind of ends there. One aspect I think that's related to your question about how people knew where to go is that Latinica served everybody even then and now. But at the same time, there are a lot of other organizations in Oakland, for example, but you can take the whole state or you can take all of the U.S. that wanted to serve the community the way we did. And so they organized their own health centers, like in San Diego, San Isidro. That was organized by, they call it, well, they argue about it was tres mujeres or cuatro mujeres. They went to UCSD. UCSD began to work with them. Los Angeles, La Clínica Familiar del Barrio, it was now Ultimed. Ultimed was very involved with the book that I was talking about. But here in Alameda County alone, there are, I think, about 9 community health centers: Asian Community Health Center, Native American Health Center, Lifelong. I go on. There's a long list. We all work together. We formed our own consortiums and we all formed our own organizations, and we began to advocate the same things, and we spoke in one voice. And eventually, that led to a statewide organization. It's called California Primary Care Association. And it didn't exist at all. After we got licensed, we existed as an advisory committee to the director of health, but it wasn't really a statewide organization. Then later, it was formed. I also was involved with that. I'm very proud of it. Jane García, who's the director of La Clínica, has been a president also of it, and she still is one of the leaders. And there have been other Latina and Latino leaders of that association, and executive directors even. Carmela Castellano García was the director until recently. Some people, I think, know her. She's well known. But in Sacramento, on health issues, it's like the 800-pound gorilla again. Their opinion about it or their own legislation that they're advancing, it's for heavy duty. And we did that by we kept coming together. And there was always differences. There were ethnic differences, there were racial differences, black and brown or white, and there was rural and there was urban and all that. So we said, okay, well, let's work out our differences together here in California. So when we take a position, it's respected. People know that it's really what we want and what we want for the betterment of our community. And like I said, that's, I think, enlightened or principled policy. And again, with that, it's possible to make a mistake. And there's some legislation I've had a little bit of problem with, but not anything really serious. But in Sacramento, a lot of the legislators now don't question about why do community health centers exist like La Clínica. They used to be patients of the community health center themselves. So you don't have to convince them about that they're important and why they're important. Really the Obamacare and the whole model that we have right now nationally is really built to have the community health centers be the main providers, I think, especially for the community that of underserved, underrepresented people. But it serves everybody, all ages. I think right now in California, community health centers serve about 6 million people for primary care. And there's a difference between primary, secondary, specialty. So we'll say they're involved with, as primary care, you have to be involved with the hospitals, but they don't run hospitals, but they do run the primary care system. Affordable Care Act. The Affordable Care Act model is not totally built on community health centers, but it's only really the only way in the long run that we're going to be able to get everybody taken care of. And the goal still remains universal health care. The goals have not been forgotten. The fact that health care is not a constitutional human right, that hasn't been forgotten. It's a hit and miss still. Even in California, but we have 58 counties, so it's very uneven, but in some key counties, I think San Diego, Los Angeles, Alameda, anyway, there are a few counties that are more advanced. But in other parts of the United States, it's still very uneven, and there's definitely not universal health care.
Y los doctores y las enfermeras, who were the clinicians that La Clínica recruited early on, and how did you recruit them?
We recruited the people that had interest in serving underserved, undocumented. A lot of the at that time, the idealism of the time was very favorable to I don't know if there's less or there's not less. I think presently there are programs like CHAIR, like there are recruitment programs in the community that are trying to get more and more Latinos and Latinas in medical school. The odds, the numbers are still not they're not good in terms of medical students, for example, health professional students. They are better. And I think if there's what's called Hispanic Serving Institutions, if you've all heard that term, HSIs, if the UCs, it's at least 5 of them right now, maybe 6, I don't know, 25% I think is what the threshold of Latino, Latina students. So of those, how many become doctors or health professionals? They could become engineers or data, people, whatever. I don't know. The chances are better, so you have a larger pool. But the actual pool going into medical school is not good. We were lucky at that time that 1969, 70, and 71 that we had students that would come and their professors, many times, they would help out as well. And we used that. But then after that, we had to have the ability to actually pay a physician's living wage, which isn't small. And we're having to wrestle with I think still the clinics are having to wrestle with the fact that the university system has abandoned the commitment to the University of California, definitely. People that graduate now are in debt hundreds of thousands of dollars. I couldn't afford to go to law school right now. It's $65,000. It's almost the same. Stanford here, I think the tuition alone is close to 60. Don't quote me on the number, but I couldn't afford it. And if anybody that goes to them has to borrow the money to go there, they have to pay it back. So it's become harder. You have to find ways to be able to help them with their debt if you want them to come to the community. I think many health centers have been able to do that, but it's difficult, very difficult.
So with those people you brought in, especially the volunteers and later the paid staff.
Well, excuse me, I'm sorry. finish your question.
The definition of health that they learned in medical school was different. Individual-based, right? Positivistically based. You had a different definition of health here that was structural,
Right.
and that was community-based, and that was based on liberation.
Well,
Did you have some kind of training for them, some way of being able to reorient them before they came into the clinic?
I think that you're right that models of education and what they teach you, what they emphasize, there is a clash. But I think that clash diminished. It's less so than it was before. There is more community health concern than there was before. You look not just at the health of the patient, but you look at the broader health. And that those things have changed. And there have been some medical schools have specifically, that's all they do. They're oriented to the community health centers. The larger ones are still very much specialty oriented. They're not family practice oriented that much. The big money is still in the surgery and plastic surgery and I don't know what other things. And so you can't take that away. It's what it is. But there's still a need to change, make more change.
The Panthers, before they let any doctor come into their clinic, they had to take a course where they made them read Mao and Freire and also Fanon. Was there any sort of thing that you actually asked doctors and nurses to do before they came in the clinic?
No, not as a requirement, but that doesn't mean that we didn't talk to them about it, that why we did what we did.
So
I think,
what was that? Tell me about
well, I think Freire, more than anything, more Freire. Mao, I mean, revolution change only comes through the barrel of a gun, that type of thinking didn't take hold with a lot of people. It just didn't. It's counterproductive. And if you look at it right now, you want to believe it's counterproductive. Look at what the NRA has. And if you say that you're going to solve it with a gun, okay, I mean, you've lost already. So yes, there are probably some people that were Maoists. There are people that had a lot of concern and admiration for Cuba and the Cuban medical system. And in 1978, I actually went to Cuba, and we focused just on what they did with health, and it was amazing. They did tremendous stuff with health that in this country, it's way behind. In 1978 and 79, that was quite a while. They've continued to do things medically, and they have actually a program where they're educating and they're sending their medical students here, and they're passing the medical exams and are practicing. But it's been very difficult. And I'll just speak for myself personally, did not get involved in a lot of ideological conflict. That this party, CP versus the Communist Party versus the Socialist Workers Party versus the Maoists versus we didn't spend a lot of time on that. And frankly, at least some parts of, at first, may not have been this way, the nationalistic part, who passes the brown paper bag test, Are you brown enough to be here, or are you not? If you're not brown enough, you're not Chicano enough, There was some of that. So there's some mistakes on that. But I think we took the approach that, if you're there by your work, to help this community, you're here. Doesn't matter what you look like. Doesn't matter, I think if we were to have insisted on only brown doctors could see our patients, no, there would have been no doctors. And even now, I mean, it's still there are more, and I think there has been success. People like Bob Montoya, Dr. Robert Montoya, I think some people know him. He emphasized the importance of public health, the importance of how the community's health is as important as the individual's health. Not to say that the individual's health isn't important, but it is in a context, and he taught that. And I think Paulo Freire, more than anybody else, because he would come to the campus, Paulo affiliated with. And pedagogy of the press was, I mean, everybody knew that. There was a liberation theology at that time, which was very important. So a lot of the people here, and I've been close to the Franciscans, for example. I'm not saying they're all liberation theologists, but there's a reason why the Pope is named Pope Francis. Why would he be Pope Francis? I mean, he's a Jesuit. I mean, you know, he's not a Franciscan. But even though in reality, going back, there's controversy about the Franciscan being oppressive to the mission system, and the oppression, or I should say well, we'll just say oppression. We'll leave it at that. But there was more than that. But I've admired and I've been close to what has been the philosophy and the practice that I've seen. And so that type of thinking, it doesn't have to be just the Franciscans, but other people that came together, like in Fruitville, that's a Franciscan, St. Elizabeth's is a Franciscan church, okay? That was the head, that was the center, the head of the whole province for the Franciscans that used to extend all the way to Guadalajara, and was all very long. So there has been a lot of people that came to do service, did it because of the social teaching of the church. Whether it's not acknowledged a lot, but I think so. That includes the Catholic Church, but I think it goes beyond that. It goes to the Methodist Church and so forth. So a lot of people are religiously oriented, whether they go to church every day, every Sunday or not, or whether they practice that way. They practice by, putting their hands on people. I mentioned earlier I think in Oakland, the Seminese Liberation Army and shooting down, they shot down a helicopter here in Oakland. They killed the superintendent of schools. I mean, no. What did it get them? And what did it? It said back, the Oakland schools have never recovered. So they're now on strike. They're on strike now. How many times? My wife's a teacher. We've been on strike like 7 times. She's been 50 years as a teacher. So in Oakland, we just had to take a different approach, but it still was liberation in our own way of looking at it, okay? Without saying you have to do it this way through this ideology. There's no orthodoxy, there's no dogma, nothing like that through our organization. And at first, though it isn't the case now, when we would get together for administrative meetings, everybody came. Everybody. Now that's changed because, well, it doesn't work. I mean, doing medical services is incredibly complex right now. If you take information systems, if you take, you can just go down the list of things. Staying ahead of that is really difficult. So that's why when we came together as other clinics in Alameda County, we began to master insurance and how insurance does and doesn't work and have it be favorable to our community. Okay, and CPCA does the same thing. They have workshops that are oriented to all kinds of different needs that all the fires that we've had, then the pandemic that we've had to deal with all that. They're gonna have to deal with the floods that are coming. Yeah, I mean, so it's incredibly complex, but we've been able to keep up with it. But if we hadn't grown to be able to do that and coalesce, we wouldn't be able to do that. I think I mentioned when the other interview that we did was the problem is we're going the wrong way. We should be going in the way of guaranteeing not only the political and civil rights that we've gained, but we need to go to economic, social, and cultural rights as a Bill of Rights in our Constitution. And that's what should be guiding everybody. You don't hear them talking about it. You don't even hear the Democratic Party talking about it. They stopped talking about it in the late 40s. Okay? And so here we are. So we're having to make do with what we have, knowing that what is needed is so much greater than what we have. And I'm sure Latinx would tell you the same thing today. We just don't have enough space. We just don't have enough services for all the need that's out in the community.
Wow, it is amazing. Kind of the repetition of the history.
The what?
Repetition of the history.
Well, I believe in cyclical. So we're in a period where we're backsliding, but we can't backslide too much further before. I mean, I just read today that what they want, the bill that just passed the House on the on borrowing on the debt limit, 35% reduction in Medicare. 35%. I mean, I think my 35%. I don't know what I'm going to do. I mean, living is hard enough as it is.
Yeah.
So there is bound to be a backlash to that. But the way they've set it up, the people that set that up have thought things through. Minorities everywhere. Minorities that are Republican. I don't want to get into partisan. Minorities are controlling the state legislatures and controlling areas. They're minorities, but they've excluded people in many different ways from participating that would send it in the direction that we would like to see it, which is having economic, social, and cultural rights for everybody, and consequences to the people to try to take that away.
Well, I'm going to ask you about what about other health organization, other health center or health organization that you have been participating or
Other health centers?
yeah.
Right. Well, here in Alameda County, the consortium, Community Health Center Network, that's made up of, I think, 8 or 9 similar community health centers. So they get together and they strategize, and they set up their own. We set up back then the way in which it's called managed care, because they don't pay fee for service anymore. It's through numbers, and you have formulas for everything. We couldn't have figured it out individually at all. Nobody could. So we came together to figure it out, and we made it work better than the private sector. In the private sector, and there is a very strong private sector still that is very. They have their doors closed. They won't take Medi-Cal. They won't take. They won't give you anything for free. Mm-hmm. And how you change that, I don't know. That's still that healthcare. As when I studied healthcare here as a law student, I did a paper on healthcare. It was how the cost of healthcare is out of reach. It hasn't changed. You can't afford it. Who can afford it? And you need community. You need health centers even to be able to get. I think to help you deal with that, to get secondary care definitely, because you can't. If you're not insured and you need secondary care, hospital care, or specialty care, you're in a very bad situation.
Yeah, you are involved with Tiburcio Vázquez.
Yes, I was a director. I was CEO there for 24 years.
But the history of Tiburcio Vázquez is like he was a bandit in California, and how this center got this name, and how is how the community received that.
I've been asked that before. That I got the same question from some of the LA Times about what's the matter with you? Name your health center after a bandit and a killer and a this and a, and I think there was a school in when was it? I don't think it was Santa Clara County. It was not too far away. They named the school Tiburcio Vázquez. And there was a backlash, and they had to put the name away. And what I told the LA Times reporter, and I would still say, is if you look at history, let's discuss history. And why, for example, would you call the 49ers okay? Why are they okay? And Tiburcio is not. Well, the 49ers, do you know how many people they lynched? Do you know what they did to the Native American population? You talk about massacres. I mean, 90%. That's how bad it was. And so you can defend that, and, you know, first of all, he never killed anybody that really anybody has proven. Having to get revenge about injustices, he was about that, and maybe he overstepped in some cases, but now what really matters is what you do in his name, and who you favor, really, in that sense, and that you favor the people that have the greatest need, and you're one with them. And so what happened at Unicity is that it started out the Unicity Health Committee. That was the name of the corporation. So the Brown Berets at that time said, no, you're going to change the name. And so it got changed to Tiburcio Vasquez Health Center, Union City Health Committee. Okay? So it was their way of making a statement that we're still here and we're still alive and we're going to stay alive. So that's the statement. That's the answer. That says, when you use that name, it says we're here, we're alive, and we're going to stay alive. So, and then you get in the morning, wow, he's just kind of like Zorro.
Another name.
You know, Zorro. Did you like Zorro? I thought Zorro was pretty cool, you know, but whether he was used as the model for Zorro, I don't know.
Yeah.
Now they call them social bandits, and of course, you know what social bandits was all about? Reparations.
Yes, yeah, reparations. You know, it didn't wait till they passed by the legislatures discussing that, but yeah, there were a lot of things that were taken, and a lot of lives that were lost, and genocide is it's not an easy subject to discuss. Going back further, or even going back to the mid 1800s, because that's what you had here.
I wanted to remind our audiences that we are in conversation with the Professor and Dr. José García, who is co-founder of La Clínica de la Raza and other movements that have opened the access to health to the Latinx community. This interview is done by the Center for the Critical Study of Health of the Health of the Latinx Communities in California. Now we are here with also with Dr. Charles Briggs, that is a distinguished professor from the anthropology department, Nancy Garcia, who is an undergraduate student here at Berkeley, and myself, Dr. Clara Mantini-Briggs. Now it's Nancy Garcia.
So what years were you involved in La Clínica de la Raza, and how did you transition from working with La Clínica to Tiburcio Vasquez Health Center?
Okay, I was involved with La Clínica de la Raza as early as 1969, which is when I came here to the law school and was involved in the Centro de Galo 69, and that's when we started talking about La Clínica. So I would say the thoughts about putting it together and finding the people in the community go back to 1969, 1970, putting all the pieces together. In 71, we opened the door, 1971. I stayed involved from 1971 till I graduated from law school in 1973. I was gone about 6 months, and I came back to La Clínica, and I stayed till 1980. So adding that up, I would say probably about 8 years, 8.5 years, that were my first, that was my first involvement. Then what we had in mind, and Dr. David Hayes Batista was a professor here at the School of Public Health, Berkeley, and we taught a series of courses, and we called, well, it was a program basically to teach people how to run community health centers. Program Clinic Administration, that's what the program is called. And from 1982 till 1991, I taught at the School of Public Health. But the students we were teaching were students who had expressed interest in running and being involved with public health services, being directly involved with them. Public health director here, Dr. Carmen Nevares. She went to UC San Diego, graduated from there, became director here at Berkeley. But there are others who have directed health centers and have been involved in a lot of other health activities. The program was geared to that. Unfortunately, I didn't remain. We set up programs such as excuse me, such as the program with Universidad de Guadalajara, Intercambio Académico, and it was ended in 1991, and I left when they ended, and they wouldn't fund that program. I left here, and I went to work with the Tiburcio Vasquez Health Center. So from 1991 till about 2012, 2013, I was the CEO of that organization. So I don't know if that answers your question, but a quick update, chronology.
Yeah. Go back to the La Clinica for just a moment.
Yes.
What about health outreach and health education? Did personnel produce materials for dissemination within the community, give community talks, go to, different sorts of events and have,
Yes.
tables, that sort of thing? How did you get the word out beyond the clinic?
Well, we got the word out initially is because we would have what we would call membership meetings. So we had people that are patients that would come together usually once a month. We didn't get, huge amounts of people, but they were the people who then in turn disseminated information that we had about how we operated, and then issues in terms of health and that were developing in the community. So we did that fairly consistently for the first 8 years of the existence. So we did that. We had also, through the Intercambio Académico, when we were in Guadalajara, we tried to study the system there. And in Mexico at that time, they had primary care clinics, and they served an area called Manzana, which is like the area around that. And they would send people out, health workers, to do that, to provide health education, to find out what was happening in the household, anything they could work with. We wound up institutionalizing that into the Clínica de la Raza, promotores and promotoras de salud. So we started that program. We started that here at La Clínica, and it is now, it's huge. It's very large, and it's the people that run. I'm trying to think of the name of I interviewed her. I'm bad on the name right now, but they have medically oriented work in the community being paid by the health centers right now, and this is a national thing. It's not just just Clínica or just California. It's spread. So that was one of the best ways we had. Then we had, at Tiburcio, I know for sure we had different things, the exercise classes, what was it, what's the dansa?
Milo terapia? That's what we call it in Cuba.
Well, it was like a human system also that when I went to Cuba. But I'm trying to think of the dance. It's not rumba, but it's anyway, the people.
Danzón.
No, it's like a danzón. Danzón Cuban, no, huh? You know?
Sí.
No, danzón is. I'll think of it.
Vamos a tener que bailar.
Yeah, I
para
should.
recordar.
But anyway, the people learn to work with each other to educate each other about different diseases, including breast cancer and different serious issues. And the people that were in charge of the programs, I know one doctor, Carlos Londoño, he was a doctor in Colombia, but he came to the U.S. and he couldn't practice his profession. But he was in public health and pediatrics in public health in Colombia. So he was the head of the program. So every subject area that they wanted to deal with, where they needed education, we started another education group. And they grew tremendously.
It'd be great to be able to interview him. What about the other responses, especially here? What about from the press? Did you get coverage from the media? And also, what about other doctors? What kind of response did you get from, especially private practitioners in Oakland?
Well, in both Tiburcio and Lacnica, we never had adverse. First of all, when we started in Oakland, doctors were gone. They had already followed the white flight out to, if they went over to San Leandro or they went into other side of the Caldecott Tunnel, they were gone. So we never got that. So our interaction mostly was with the County Board of Supervisors and Highland Hospital. So we wound up doing this. There were committees that were set up that we began to change Highland Hospital. And Highland Hospital has gone through a lot of different changes over the years. And it's a very strong hospital now. So I think, and it's not us versus them. It's like we do compete sometimes, especially for limited resources. I mean, that's always been the case. But somehow we were able to work it out that we were on a fair formula where we are able to pay people. One of the objectives was to have people in the nonprofit sector, community-based organizations, pay as much salary as they do in the county. And I don't know if they've eliminated the gap, but it was narrowing by the time I left. So we didn't have that. In Union City, mostly there were doctors that worked with us, especially for delivery, and we were able to find ways to make sure that we mainly worked with St. Rose. St. Rose Hospital provided us hospitalist care to some of our patients. We worked out arrangements so they could be paid. The major one that we really have worked with everywhere has been Kaiser. And our relationship then and up to the time that I left, and that included the Tiburcio Vasquez years, has been excellent. We have an excellent relationship with Kaiser. And that includes the permanent medical group, of course. And they have, especially around hypertension, there were programs that high blood pressure and different programs that they set up that we duplicated, and they worked very well.
Did the press cover?
The press, the press is very interesting because when I went to Tiburcio Vasquez, I went there because I was really a crisis manager, because Tiburcio Vasquez had gone into they'd gone over the cliff. They weren't able to cover their salaries. This is 1991, 92. So all the media attention then was about the controversies having to do with it. We would survive or not. As we convinced them we are able to survive, we're as strong as ever, and we're moving ahead, the coverage that we got from them was very good, but they didn't have locally, at least at that time, that much of a health interest. They just didn't. And try to get them to do that, we didn't think it was worth that extra effort. We could do it ourselves better than they could do it for us. And especially since we had to do it in Spanish, it wouldn't have helped. They didn't have a Spanish language newspaper at that time. Later, I think there was one, and we always had a call them. We were always able to get them to cover issues for us. So, good relationships.
That's good. I think it. I was to ask how was founded Tiburcio Health Center, Tiburcio Bar.
How was it
Yeah,
funded?
Funding. How was
Funded or founded?
Funded or founded?
No, apoyado económicamente.
Funded.
Well, the same way that we all start out with small grants from different. First of all, it was volunteer. Everything was volunteer.
Mm-hmm.
So Planned Parenthood was very helpful at an early stage. Then we were able to get small grants to do health planning. Then we were able to. We had a big step in I think it was 1973 or so, 72, where we were able to get the county to become one of our funding sources. And a name that sticks out very much, is important here at Berkeley, is Tom Bates. Tom Bates was later, he was supervisor then, but later he became the mayor of Berkeley. I think he's definitely retired now. But the doors are open that we could openly talk to. We go into the offices in the back to talk to the supervisors. So we convinced them that federal law at that time, after the Vietnam War, provided for block grants that could be used for different things locally that the counties could decide upon. So it was like what we would have spent if we were going to war in Vietnam, but we're not spending. So this is a post-Vietnam kind of block grant program for communities. So we convinced them that healthcare was a major element of that, and that opened up the funding for the county. Later, as we went along, we had to go from not being licensed to being licensed. So in being licensed, the deal was we get a license that allows us to bill Medicaid, Medi-Cal. And so the combination of grants and then Medi-Cal was enough to cover the staff and facilities costs that we had. And that began to grow. So then we got federally funded. We got money from the federal government, a grant, and so forth. As things have gone along, it's more now, not grant-based, but more insurance-based funding. Different people, to the extent that they're covered, are able to cover it. And it's always been on a sliding fee scale. After we got licensed, we could only charge people depending on their a percentage of what they were based on their income. And so we put that all together to cover all our costs.
So what an honor to be able to speak with you. I mean, you emphasize the cyclical nature of these struggles. And as we face new crises, new confrontations, and new opportunities for being able to achieve liberation, it's wonderful to be able to listen to somebody who inspired, right? Over 50 years ago, one of the most important innovations, lasting innovations in healthcare and in justice in the area. So thank you so much for your wisdom and for being able to join us today.
Thank you so much to all of you and to the Latinx research. Get used to the X. We got X's everywhere. Mexicanos, Chicanos, the X, the J. But anyway, I thank all of you for what you're doing, and it's very important. And to fill in the period that has an emptiness about what was really done, to fill that historical gap is very important. To the extent you're doing that you continue to do that, that's what I understand. Part of the legislative objective was, I applaud that. And I say it's just more of the same, because for people to understand what happens when you have people of like mind, whether it's by circumstances or planning, and in this case, I think we established that we didn't plan it. It just happened that people were in the right place at the right time, and they generated this dynamic force, a movement, and it grew. And that it still exists and is growing. And the question right now is going to be how much more it will grow. Not much, not are we stopping, no, not, and how much more can it grow. And in those areas that have not received the attention that's needed, how that can grow again. That there are resources that can be found. There are knowledgeable people, and there are people who will work with you to reach the people that have the need. You can't ever just dismiss that. We have to really think carefully with the migrant situation at the border, what's going to be happening there. And I don't think there's been enough thinking about that, because it isn't just a matter of if they're sending troops right now and they're getting a number and all that. Well, you know, every country that's civilized in this world has, provisions for allowing people to have refuge. And to have the chance to be able to prove what they can prove, and to escape all the abuses that they've been subjected to, and to be a force that push any of it back to an abusive, violent situation is wrong. That we still have to have the resources here in the communities where people are going to be going, and I know we don't have enough. So my plea again is make it universal right, make it a human right, make it economic, social, and cultural right in the Constitution of the U.S., and never ever go back. As a matter of fact, go forward on civil and political rights. The UN gives you a little map on how to do that. If this country would only adopt the Universal Declaration of Human Rights, it would be the a great step forward. And to ignore all this other stuff that says I'll go the other way. Jim Crow and slavery and all that is over, and it'll always be over. And we will be liberated. No, not completely.
It's a wonderful final statement. I guess your question is really in the hands of people like Nancy.
That's right.
Because after all, part of this project is to help work with training a new generation of leaders.
Well, I think that's what the obligation is of the university. In part, it has a lot of things it has to do. I realize that. I've been there, I know. But it has to give people the focus on what the research is in places that really matter, so the students know that here, they know that in the future, and they will make sure that happens here for their students that follow, and their siblings and their and everybody else. It's make that pipeline real, all the way to the top.
That's muy buena. Well, thank you very much.
Pues muchísimas gracias,
Sí,
y agradezco que me han dado esta oportunidad, y ojalá que se pueda lograr lo que queremos.
En eso estamos. Y bueno, queremos dar gracias por la paciencia de toda nuestra audiencia, nuestro asistente técnico, Agustín Cruz, también estudiante de aquí de la universidad, que nos ha ayudado con la grabación, y bueno, a nombre del Centro de Estudio Crítico de la Salud de la Comunidad Latina y el Latinx Research Center, le damos las gracias, y bueno, siempre sienta que esta es su casa cada vez que pueda.
Gracias.